Peace River North.
Thank you, Mr. Speaker. I'm proud to be able to stand here today and speak on the motion, Make Mental Health and Addictions a Priority. I'm glad to see that this issue is one of the first issues to be discussed in this new session, because we must all remember that COVID is not the only public health emergency in BC. The overdose crisis is truly one of the greatest challenges that our province currently faces, and the time for action has never been more needed. Addiction continues to take horrific toll on the lives of people in cities and towns throughout the province, and it's made worse by the toxic drugs currently circulating throughout our communities. The latest illicit drug overdose report by the Coroner's Service reveals that this crisis shows no signs of improving, as July 2021 was BC's second deadliest month of illicit toxicity deaths ever recorded. People of the Peace region have continually experienced the fails of this government. We know the tragic toll all too well, as Fort St. John in the Northeast continues to have the highest per capita overdose rate in the province. It is absolutely heartbreaking that month after month we see this trend continuing with little being done by this government. British Columbians are desperate for action from this government, Mr. Speaker. There are crucial steps that this province could take. We've continued to leave these options on the table. For months, the official opposition has called for the NDP government to activate the Select Standing Committee on Health so we can take an all-party public approach to tackle the mental health and addictions issues faced by countless British Columbians. This committee is already there, Mr. Speaker, but this government has not called it together. Why? Sadly, this continues to be ignored. Why? I encourage everyone to ask the government why and demand more. Government could restore the funding that was cut from police services for life-saving naloxone kits, which are essential for frontline emergency workers responding to the overdose crisis. And just as naloxone kits save lives, having a healthcare system with the capacity to help those suffering also saves lives. For months, we have called on this government to do more to address the crisis in the north and health authorities across British Columbians that are now reaching a critical point. In fact, the ICU in Fort St. John has been closed since June of 2020 because of continuing staff shortages, and patients are being transferred to Prince George. In fact, Northern Health says that there are just 5 permanent nursing positions in an emergency department that needs 20. Yet, the Fort St. John Hospital is not the only hospital that is in a dire situation. Elkford Hospital in Cranbrook recently announced its DR will be closed until further notice. Royal Inland Hospital in Kamloops is so understaffed that the workload of more than a dozen nurses is sometimes being handled by 3. My colleague from Peace River South has continually had his hospitals on diversion. These are just a few examples of the situations that have only gotten worse in this pandemic. COVID has not only worsened the overdose crisis in our communities, it's put an immeasurable amount of strain on all of our healthcare workers across the province. Hospitals, the entire healthcare system, in fact, in some areas, I would say, is on the verge of collapse. Nurses, doctors, and healthcare workers are being pushed to the point of exhaustion, while vital hospital beds are being occupied by a growing number of COVID patients. When people in crisis can't find a hospital bed or an ICU unit ready to take them, it is a matter of life and death. We can no longer accept just words of empty promises. We need action today, Mr. Speaker. British Columbians demand it. British Columbians expect it. We must commit to a plan for a comprehensive mental health and addiction system and a complete review and overhaul of our healthcare system. One that will include a complete audit of Northern Health to identify and address the staffing shortages that are plaguing our hospitals and the entire healthcare centres. Only then, Mr. Speaker, can we bring the services and the supports that our communities need and must have to address this overdose crisis. Thank you, Mr. Speaker.